Hello, good evening. Welcome to my class. Can you please tell me your name and your favorite food as an icebreaker?
Yeah, my name is Damilare Adele. My favorite food is rice.
Okay.
My name is Clement Bofo and my favorite food is fufu.
Okay. Thank you so much. And I'm going to be your tutor for tonight. My name is Sandra Owachi. I'm going to be your teacher for just 15 minutes. So this is the exit in case you want to go out. You can just use the toilet here. Okay, so we are going to start our lesson. By the end of this lesson, each one of us are supposed to be able to define CPR, to follow the steps of Dr. CABCD, to perform CPR on an adult, and then give few reasons why we perform CPR. Okay, so we are starting by what is the full you know CPR is an abbreviation. So what is the full name for CPR?
The full name?
Yeah.
That is cardiopulmonary
Resuscitation.
Yeah, that's very good. That's true. So the full name for CPR is cardiopulmonary resuscitation. So what is the meaning of CPR? The meaning of CPR. When you say CPR, what does CPR mean?
It's a life-saving emergency procedure to save someone's life, just to maintain a blood flow.
That's so true. So as on the screen, as it has been displayed on the screen, CPR or cardiopulmonary resuscitation is an emergency life-saving procedure used when a person's heart stops beating to maintain blood flow or oxygen to vital organs. So normally CPR is normally used on people that heart stops beating, or when a person stops breathing, or when a person drowns in the water and then you bring the person out. But the most important thing about CPR is you do not perform CPR on anybody who is breathing, even if the person, you think the person is unconscious or anything of that sort. If there is a little breath from that person, nobody is supposed to perform CPR. So that's all about the definition for CPR. And performing CPR, just as is displayed on the screen, it helps to maintain the blood flow and oxygen to the vital organs. So performing these things normally helps the person who is unconscious to come back to life. Okay, so we are moving straight to the next one. Okay, so we have the basic way of performing CPR, and also we have the Dr. CABCD steps to perform CPR. So we are going to use that one in performing CPR. So this is how to perform CPR in the basic way, but we want to use the most used steps in performing CPR. Just a minute, please. Okay, so these are the most simpler steps. So the reason why we said Dr. SABCD, each of the letters stand for a particular thing, just for it to serve as a reminder. So as it's been displayed on the board, on the screen, can we all look on it and then try to identify each of the letters that has been displayed in place of the main words? So the doctor, the D stands for what?
Danger.
Danger, very good. What about the R?
Response.
Response. S?
Send for help.
Is send for help. A?
Airway.
Airways. B?
Breathing.
Breathing. C?
CPR.
CPR. D?
Defibrillation.
Defibrillation.
Yeah, defibrillation. Okay, so these are the simple steps we can follow in order to perform CPR on an adult. People normally perform CPRs on adults, children, and even, let's say, is it a less privileged or people or disability people? But the most important thing we are going to learn about is how to perform CPR on an adult. An adult, not either on children or any other person. So these are the steps. The first one is danger. And what does it say on the board? Danger stands for what? Like the reason for choosing danger.
To assess the scene,
Yeah.
potential dangers.
Yeah. So when you meet somebody unconscious, either the person is lying down, the person is how do I put it? If you see a person lying down unconscious, an adult, the only thing you are supposed to do is try to perform CPR. So the first thing you are supposed to do is assess the environment. That is assessing the environment to see whether there is any danger around, including life wires, including any hazard, anything that is risking you, the person trying to save that life, and then the person on the ground. Okay, let's move to the next one. The next one is response. What does the response say on the screen?
Yeah, check for a response from the person by asking their name. Or squeezing their shoulders.
Yeah. So if the person is lying down unconscious like this, after you have been able to assess the environment, the next step for you to do is to make sure that the person will either respond to you to help you to know whether the person is conscious or not. So the first thing you will do is you can either use your ear to sense whether the person is breathing, or you can pinch the person's shoulder by asking, hello, are you alive? Hello, are you alive? Hello, are you okay? Hello, are you okay? So you can shout for the person to know for you to know whether the person is alive or not. Okay, what is the next step?
Yeah, if they are not breathing, you send for help.
If they are not
If they are
breathing,
not responding,
you just send for help. So you can either shout for help, or if there is any bystander around, you can ask that person to call for help, either through 999, that's the ambulance, or they can call for other people for help. In case they are tired, they can take over from that place. What is the next step?
yeah, airways. You open the person airway by lifting their head
By
back.
Tilting their head back.
Tilting their head backwards. So for you to check their airways, you can either tilt their head upwards like this to check whether there's anything in their mouth or in their nose. So if there's anything, then you just make sure their head is back to the neutral position. Okay, so what's the next step?
CPR.
Okay.
If the person is not breathing, perform CPRs with 30 chest compressions.
So if you are checking the person's breath, it shouldn't be more than 10 seconds. Immediately you realize that it's either 10 seconds or more than 10 seconds, you immediately start CPR. So starting the CPR, this is how you start the CPR. Do not interlock your hand like this. Some people will do like this to do CPR. No, you have to do your hand like this. So you start CPR, immediately you realize the person is not breathing. And then how to perform CPR, so you have to do 30 chest compressions and then 2 rescue breaths. Okay, so this is how you do it. It's like this. So you make sure the person's head is on the neutral position. Okay, so you start the CPR, so you do like this. 1, then you be counting until it's 30. So when it's 30, you make sure that you breathe into the person's mouth. That is the rescue breath. You breathe into the person's mouth once, and then you come back to do the other 30 chest compressions again.
It's okay.
It's okay. And then you breathe into the person's mouth again. Okay, so what do we do next after we've been able to do the CPR?
Yeah, defibrillation.
Defibrillation, or you use the defibrillator. That is the last option. Sometimes when you are doing the CPR and then the other person had called for help for you yourself, you're able to call for help. The ambulance or the professional helpers might come in. So fortunately enough for you, maybe when you are performing CPR, when they come, you must stop. You might not even need to use the defibrillator. So, but if it comes to either you are supposed to use the defibrillator, it's just a small machine that has prompts on it. It will show you how to. This is how the defibrillator looks like. They have different types of the AED. It's normally shortened as AED. We have different types, so this is how it looks like. It has prompts on it, so you do not have to worry. It will teach you how to use it in case you are in need of it. Okay, thank you so much. May we move to the next topic, the next subtopic. That's the purpose or the reason for performing CPR. Reasons why we perform CPR. What are no the reasons? Oh.
That's all. Key reasons.
Okay, to
Save
save
lives.
Yeah.
Read more. So you scroll down.
So there are definitely reasons for performing CPR as displayed on the screen. So what is the first step for performing CPR? We do not perform CPR just to have fun of it or just to try our skills. We perform CPR for numerous reasons. So what are some of the reasons for performing CPR as displayed on the board?
Save lives.
Yes, to save lives. CPR is essential in cases of sudden cardiac arrest where immediate action can double or triple the chances of CPR. So when CPR is done, it gives extra mile for the person to survive, just as on the screen. Without CPR, the likelihood of survival decreases significantly within minutes. So if the person is unconscious and then there's no person to perform CPR, the person might die in a short time. Okay, what is the next reason for performing CPR?
Maintain blood flow.
Yeah, it maintains blood flow. Ikechukwu, are you here? It
Yes.
maintains blood flow. When the heart stops, blood flow to the brain and the other vital organ ceases. That's really true. So when the person is unconscious, meaning when the person becomes unconscious for a very long time, the blood that is flowing through the heart or the brain to the other parts of the body ceases to flow. It ceases to flow. CPR helps keep blood circulation. So when you start doing the CPR, the heart starts to pump again. It starts to pump and then it goes through the vital signs or the organ of that person. The brain can begin to suffer damage within just 3 minutes without blood flow, making timely CPR vital. If CPR is not performed on a person as immediately as possible, within 3 minutes, the person's brain dies. Okay, so what is the next step? What is the next reason?
Increase effectiveness of AED.
Yeah, it increases the effectiveness of AED. That's the defibrillator. Performing CPR and then using this makes it important. Okay, what is the next one?
Empowers bystanders.
It empowers bystanders. Knowing how to perform CPR equips individuals with skills. So when somebody is performing CPR and you're a bystander or you're just somebody standing there to see what is happening, it equips you with different skills for you to be able to perform CPR. When such an incident happens and then nobody is there to perform the CPR, at least you learn something from what the person was doing. What is the next one?
Improve survival rates.
Yes, it improves survival rates because if See, if CPR is not performed on a person, just 5 is okay. If CPR is not performed on a person, the person might die. So performing CPR increases survival rate. It makes people to live, because I think there are lots of people that survive from CPR rescuers. So that's it. Okay, thank you for being in my class. Thank you so much. Thank you so much. Thank you for